Hello guys, my name is Alam Khan and I'm from the healthcare. I have done my specialization in mental health and substance abuses rehabilitation, and I have been working for the last 5 years in the mental health. So today we will be discussing about traumas. What is trauma and how it affects individual mental health. So let's go to the topic. What is trauma? Trauma is unpleasant event which can affect your life forever or for a long period of time. So trauma can be for a short period or it can affect your life for a very long time. And what are the symptoms of trauma? Nightmare during sleeping. People who have trauma, they can see nightmares during sleeping time, continuous thinking about the event. So whenever they are thinking, they are constantly thinking about the situation which happened, unpleasant situation in their past, recent past, or in the very past. Difficulties focusing on future goals. So people who have trauma, they have difficulties to focus on their future goals. Panic attacks and flashback about the event. So people who have trauma, they can get panic attacks and flashback. Like flashback means the person think and emotionally, psychologically, the person goes back to the event, the unpleasant event which happened to him or her. Difficulties to talk about the event. People with trauma, they are not necessarily uh, able to talk about their traumas. Absence of positive emotion. So there is absence of positive emotion or lack of enjoying normal things in life. People with trauma, they don't enjoy normal things like normal individual can enjoy. Very easily threatened. So people who have trauma, they can be very easily threatened. Self-harming thoughts. They are thinking that they can get rid of the traumas in their head by harming themselves, committing suicide, or doing something to themselves. These thoughts come from their unconscious psyche because they cannot understand what is happening in their unconsciousness. This is the trauma which is affecting them constantly. People who had trauma in early life, they can develop PTSD. What is PTSD? PTSD is post-traumatic stress disorder, which is a psychological condition which affects one mental health. So PTSD is post-traumatic stress disorder. A person who has trauma can develop this kind of psychological condition. Who are at risk to trauma? So vulnerability to trauma can be more children and young age people, because young age people, they don't have the psychological defense mechanism that they can defend themselves, so they can be very much vulnerable. Violent partners, somebody partner is violent, so the person can dominate. Usually narcissist people and psychopaths, they can use their influence. Drug addicts parents, so parents are drug addicted. The children can be affected by their behavior, their violence, and their home society is not positive, so the person can develop trauma. Financial vulnerability and dependency on someone. Someone is financially totally dependent on somebody else, so these kind of people can develop this kind of trauma because the person financially is dominating the partner or the person who is in the relationship. So they can put them emotionally so much down that they can develop trauma, unpleasant sudden events in your life. So something serious happen in your life that affects your life. Lose of parents at the early stage of life. So a child who loses parents at a very early stage of life can develop trauma. So let's move on. Next stage. So physical abuse is somebody's physically abused, can develop mental illness during childhood. Somebody is mentally ill during childhood can be affected, can develop, because they are vulnerable to different kind of situation. People can misuse, sexually abused, emotionally being neglected. Somebody child is not taken care normally, has been ignored, emotionally, physically neglected. Parents divorced or separation, domestic violence in the home society. There is violence, sexual abuse during childhood. Individual is sexually abused during childhood, they can develop traumas. So what kind of behavior people who have traumas? Behavior change. People suffering from trauma can affect their behavior extremely. This behavior could be seen in individual daily hobbies in daily life, such as alcohol and drug problems, in order to find shelter from the past trauma. So people who have trauma, they might self-medicate by taking drugs or alcohol use in order to hide their psychological pain or to medicate for the time being. So they tend to use drugs and alcohol. So let's move on to the treatment and rehabilitation of individuals suffering from traumas. The process of rehabilitation. I have been working for last 5 years in the mental health, and I have been dealing with different kind of patients, different kind of mental disorders, traumas, and so on. So I have made myself this kind of diagram or process, how the individual could be rehabilitated. So the first step is to come to the psychiatric health center and seek help. Seeking help is very essential. Then therapy. Therapy finds, in therapy, the individual can discuss, speak out about the trauma, and the therapist can find out what kind of therapy the individual needs. Exercise in sports and exercise can boost up a person psychological health, physical health, and it can promote the process of rehabilitation. Lifestyle changing, so lifestyle, not alcohol taking, no drug uses, and so on. Healthy lifestyle, healthy people relationships. So in the inner circle, the individual must have people around in the circle who are healthy, not violent or so on. So then we move to spending quality time in the nature reduces stress and anxiety. It's also called ecotherapy. So the person, this picture is taken, I have taken myself, so just in order to explain what is the effects of nature. So walking in the nature, the person can feel really relaxed and calm, away from hustle bustle and noisy world. Walking in the garden or sitting by the lakeside, it can also promote mental health and well-being. So about this topic, there are some references you can find about traumas. So there are links you can go to the topic and find out about this trauma. Thank you guys for the day, and we can talk about different kind of mental disorders and the process of rehabilitation and what is mental health. So we will be talking about bipolar disorder in the next talk. Thanks guys for watching, and have a nice day.